And it's going to be a very significant month for all of us, because not only this Saturday is the last class, but the next Saturday, which is 9th July, from 8 p.m. to 9 p.m., you will have the convocation. So all your efforts that you have done in this class, in this course, will be result in you being certified. By mistake in the broadcast, I have written the date as 2nd July itself. Well, that's a offshoot of all this multitasking that's happening. So the the convocation is on next Saturday, that is 9th July. So today we are going to talk about what really a genetic report really reveals, because we've studied fundamentals of genetics, nutrition, nutrigenomics, and epigenetics. So when, let's say, I do my own genetic testing, what are the insights that I can really anticipate, and how that can be related or correlated with our lifestyle, and what kind of corrections that's required fundamentally with nutrition, our food habits, and with our lifestyle. So that's something that we're going to talk about. And to do the honors, we have, as usual, our coordinator for CCNG and a nutrigenomic counselor and nutritionist, Reena Baliga. So Reena, warm welcome to you as well, and go ahead with the class. I'll be back at the end of the class. I'm sure today we're going to end by 12 o'clock, so that we end on time, and we complete the course. So I'd like to come back and then congratulate all of you for attending all the classes, and for also answering the questions. I'll actually give you a list as to who is lagging behind. Most of you have done very well, and the results will be out next Saturday. So over to you, Reena.
Thank you, Stan, sir, and very good morning to everyone. I don't have any doubt in my mind we are going to complete it before 12, definitely, because today we just have two main chapters to cover. And I'm sure all of you have or must have gone through it. The chapters that we are going to talk about today is going to revolve around the genetic report as well as the action plan that is given, which is these two main parallels that we carry on over here in Velocity Genetics. So I will just share my screen, but before we go into the actual, what the Velocity Genetics program or the report entails, can I ask you all, how many of you have got the genetic test done so far? Not yet? Okay. Those of you who has got it done? Okay, so Bapisa has got it done. Anyone else? Now, the reason why I'm asking this is because to those who have already, had it done, they would be aware of what exactly the genetic report contains, or, it has something that can tell you more about your health. But now what I'm going to do is, in any case, I'm going to take you through it. I'm going to summarize it so that you understand what are the various sections that we talk about, how exactly so far, whatever you have studied, in all the previous chapters, the applications of nutrigenomics, epigenetics, how is it going to apply finally when you see the genetic report and what it's about. Okay, so before we go through the genetic report and what it contains, let's understand what is the importance of genetic counseling and genetic report per se. Now, since we've already gone through how exactly a genetic test helps, let's just revise a little. Okay, now a genetic report is a tool, but it is different from a usual diagnostic test. Can you give me an example of diagnostic test? Can you give me an example of diagnostic test? Yes. Lipid profile? Yes. Blood test is a diagnostic test. Correct. So blood test that includes everything is a diagnostic test. Scans like CT scan, true. Urine test, yes, it is a diagnostic test. Okay. So now that being established over here, there is a main difference between a diagnostic test and a prognostic test, right? Now, when we talk about diagnosis, we are trying to diagnose an issue. or a problem. Now that could stem from your current parameters, your blood parameters or your scan results, etc., wherein a physician or a doctor is trying to identify what is the issue with your body currently. Now these parameters, be it lipid profile or scans, these are subject to change. Now just because your blood sugar profile is a little elevated right now, it doesn't have to mean if you take care of your diet, lifestyle, etc., it's going to be elevated, let's say a year later. You might be able to manage it better, right? So these parameters are subject to change because of your lifestyle, diet, and everything. Now, when we talk about prognostic test, it is done only once in a lifetime. It is not repeated. The reason being, do your genes change like sequentially? Do they change over time? Like your blood parameters, does your DNA sequence change? No, right? That itself is the basis of a prognostic test. Now, a genetic test is called a prognostic test because it tells you what are you more likely to develop later in life, or currently, if you have any health issues, could the root problem lie in your genetics? Since we know there can be n number of factors that can dictate your current health issues, lifestyle and diet being one of them, but even environmental influences and genetics being a part of every health issue. Most of the health issues, it could stem in genetics. The reason being, it has been passed on through generations. But like we saw in the chapter of epigenetics, if you recall, does it mean just because it's in your genetics you will end up getting it in the future? No. So a lot of other parameters also play an important role, right? So now the genetic test is not only predictive, but preventive in nature. If someone tells me that, Reena, you need to get a genetic test done, you'd get to know what all health issues are there in your genetics or in your ancestry. And then, you can actually have a look at it. So for a minute, I'd be like, wait a minute. If I have to know what all health issues I have in my genetics, won't that scare me? Won't that create this sense of, this fear that, I might end up with it? So what exactly would I get from getting a genetic test done apart from just knowing? So it's not just predictive in nature, but also preventive. So not only I will get to know what are the health issues that I'm predisposed to, but also the tools or the ways by which I can prevent it. Or if I already have it as an issue, let's say lactose intolerance, I already have lactose and gluten intolerance. So how can I manage them? Right, through changing my diet and changing the food sources that I obtain my nutrition from without putting myself at a risk of deficiencies. Okay, there is a difference between eliminating an entire food group or eliminating certain foods. So genetic tools or genetic test as a tool helps you in leading a healthier life, making better choices tailor-made to your own body, to your own DNA. So there is this question that I keep getting asked, and a lot of nutrigenomic counselors, of course, they get asked, is what is the main difference between normal nutrition and genetic nutrition? I mean, it's not like we are giving different foods altogether, right? If I'm giving bajra roti and the nutritionist who is not a genetic counselor is also giving bajra roti, the roti is the same, right? So what is the difference when it comes to these two different types of nutrition? Now, understanding in a traditional nutrition diet kind of a setting. You go to a nutritionist, the nutritionist is going to take your dietary recall, she's going to understand your BMI, calculate your BMR, and finally she's going to make a diet that is tailor-made to you, but in a way that it only fits your BMR and your BMI, your requirements as per your even medical issues. So nutritionists also take into consideration your medical issues. Now, how is that different from a genetic diet? So a gene-based diet is called a targeted diet or a targeted based nutrition for a reason. It not only takes into consideration all of the said parameters that I just spoke of that nutritionists normally do, but also takes into consideration your DNA, because what you have inside you cannot change. You're born with it, right? But you can still prevent those particular traits or those particular predispositions from being expressed. And there is no room for trial and error here. Now imagine a nutritionist is unaware of your genetic report because she tells you that of course milk and milk products ka group aapko khana hai, aapko itna itna, of course low fat ye lena hai, and when it comes to whole grains you can have wheat, rice, jawar, bajra, whatever. But now when it comes to your genetic report, if you are intolerant to lactose and you haven't developed symptoms yet, and still you continue taking that food, at some point in time, your intestines would be so affected that you won't be able to absorb most of the nutrients. So here what we are doing is there is no room for trial and error. भले ही आपका symptoms शुरू हुआ हो या ना शुरू हुआ हो, but आपको जानना जरूरी है what are the foods that can cause an issue. Another example I'll give you, metabolism of nutrients. Now the diet is made as per your BMR calculations, physical activity, etc. But what about the bioavailability factor? What about the metabolic factor? Are you able to metabolize certain nutrients better than the other person? Or is it that your metabolism is much lower? And it does not talk about your BMR. BMR talks about your, yes, it talks about your basal metabolic rate. But I am talking about how each nutrient in your body is metabolized. And if by now you must have realized because of the imbalance of these nutrients, it is at the root cause of a lot of health issues, right? So one of the categories that we test, which is nutrient deficiencies, becomes a very, very important part of your entire report. All right. So just like nutrition deficiency or nutrient deficiency, sorry, risks, there are many other categories that are tested, right? So Velocity Genetics program, just like the genetic test, it's just done once in a year. You do have wellness help desk facility wherein if you get a genetic test done, let's say today, you will avail that facility of 1 year from the date of your counseling or from the date of your report, because once you start following is when you will start having doubts, when you will start having issues. Now after a while, let's say a month or two, you will start seeing changes, and then you might want to modify it a little, or maybe you are saying that what, this is not convenient for me anymore, can we change a few things? So these are the ways by which you will be provided assistance. Okay, so the Velocity Genetics testing, DNA testing program, in this case, we have 18 categories and 210 tests today. We started with 33 phenotypes when we started. I remember taking counseling for 33 phenotypes, and then we moved on from 33 to 68. From 68 we came to 105, and today we have 210 phenotypes, right? So that is quite a huge jump, and all of you are here, you are able to see all of these phenotypes now. So I'm going to take you through each of these categories first, and then I will show you the report in front of you. I'm obviously not going to counsel you all, but I am going to take you through it in a way that everything will be summarized, ताकि आपको समझ में आए what exactly it is about. Okay, so now, like I spoke about nutrient deficiency risks, this category gives you the metabolism of nutrients. This is not your blood test that's telling you, what, you have vitamin B12 deficiency, vitamin D deficiency, E. Nahi. This is telling you which nutrient you are more prone to a deficiency because of either the lack of absorption or metabolism issue in your body, either because of certain factors not being okay on the basis of the genes you carry. Basically, the risk variant you carry puts you at a risk of certain nutrients not being absorbed that well. Now, this could also be one of the reasons why, people say, I don't know why I have recurrent B12 deficiency, or why I just corrected this deficiency, but again I have this deficiency. I have been taking care of it through food all the time, and I keep getting this from everybody. It's not just the clients or patients, it is the people I know, or my friends. Recently one of them was like, my diet has food that is rich in B12, I don't know why I'm deficient in it. So this tells you that there is another factor that you need to take into consideration, which is your own body's absorption or your own body's metabolism. So maybe you are a non-vegetarian and your B12 is taken care of through your diet itself. But who is to say that you're not compensating for that metabolism lack in your body, right? So now when it comes to this particular category, it not only helps you in understanding where or which food products you need to increase in order to be able to manage certain nutrients, or in this case, if you are already deficient, what is the root cause of that, and how certain foods, right? Certain foods can help you in increasing the absorption of other nutrients. And what we call this is a nutrient-nutrient interaction. Do you all have any idea about nutrient-nutrient interaction? Any example that you can give me? Any nutrient that helps in the absorption of another? Come on, this is, I think some of you will definitely guess it right. Absolutely, vitamin C. Yes, vitamin C helps in iron absorption. Okay, and just like that, there are certain other nutrients like vitamin B12 that depends on calcium for its absorption. Okay, vitamin D and calcium also go hand in hand. So this particular relationship between certain nutrients, it helps you in bypassing the chances of deficiencies in your body without having to rely on supplements in some cases. Yes, absolutely. CalMag and vitamin D work synergistically. In some cases, yes. In some cases, vitamin K and vitamin D is also given together, especially in bone-related issues, because vitamin K has been known to be a factor that helps in increasing the absorption, especially in cases where there is arthritis or bone-related problems. Okay, yes, vitamin B12 and calcium is, yes, absolutely, Bapi sir. So vitamin B12 usually जब absorption कम रहता है किसी का, so calcium rich foods including piperine extract. You know what is piperine extract? It's there in pepper. It helps in increasing the absorption of B12. Now we're just talking about B12 and vitamin D, but there are plenty others. You will see once I show you the report how beautifully it is brought together. Food intolerances and allergies is a different category. Now, this is a second category which talks about the main differences between intolerances and allergies first, because these two are completely different. You never try and confuse the two. Because what happens is a lot of people, they think that, yeah, I'm allergic to wheat. But when what they're trying to say is they cannot digest wheat properly. But allergy is a completely different ballgame. The moment you consume certain food and you start developing clinical signs like rashes, inflammation, etc., now that is a clinical sign that's associated with an allergy, which you can actually experience within a couple of hours, to 24 hours of consumption of that particular food. And in that case, we usually ask a person to eliminate certain foods that they observe are causing the allergy. But when it comes to intolerances, this may be building up in your body and you may not even know. So rewind back to your chapters of intolerances. Do you remember what intolerances we spoke of? We spoken of caffeine, gluten, lactose, right? And also metabolism. As per metabolism, we talk about salt metabolism, and specifically allergy here, we are covering peanut allergy, which is one of the most common allergies that people have apart from mushroom, egg, pineapple, etc. Okay, so here intolerances will give you an insight into what exactly your body may not be able to digest, and because of that it will affect your intestines. Now let's understand your anatomy. When you talk about intestines, this is the main place that absorbs all of the nutrients, the small intestines, right? Now when it comes to inflammation associated with this very important organ, what do you think is going to happen? The intestine, the texture, or the surface of the intestine will become smooth. It's actually a little wavy if you go to see, right? That's how the texture is. Now the reason why it is like this is because so that it can absorb more, okay, because of the surface area. But now when it is smooth, what is exactly happening is there is excess mucus secretion, because of which the nutrients don't get absorbed. Because of that, you will end up with nutritional deficiencies as a result or a secondary reason of your intolerances. Okay, so intolerances is not just not being able to digest something, it could be a root cause of many other health issues to come. Okay, so it is not supposed to be taken lightly, and intolerances, this particular category is very popular with us. Okay, when it comes to dermatology, we're talking about skin related disorders. Okay, so a lot of people, right from children with acne related issues that keep recurring, to issues like sunburns, tanning, eczema, then we are covering psoriasis and how can you even treat psoriasis, whether there is a need for any UV radiation or no. Vitiligo. Vitiligo is white patches on your skin. Now, when it comes to vitiligo, there could be certain other trigger agents as well. It could be vitamin D deficiency, B12 deficiency, or it even could be, gluten that could be a trigger for someone. So all of this is checked under dermatology. So it is not only telling you what you're predisposed to, but what could be the other factors that could trigger it in your case genetically. So it's specific. Okay. Then you have weight management. Weight management is something that everyone, at some point has certain goals. Now, it doesn't have to always be weight loss. It could also be weight gain. Maybe you're a person who just wants to maintain your weight, but you're not been able to do that. So when it comes to weight management category, it not only talks about the predisposition to obesity, but also tells you what could be the reason for that. In some cases, there is a hormone called adiponectin that's not been able to secrete properly, which is the reason why you put on excess fat. In some cases, there is a very advantageous gene. So we also talk about advantageous genes throughout the report, where in the solution of certain issues, genetic issues, could be found in your genetics itself. When I take you through the report, you will understand it better. But the weight management category helps you in understanding the macronutrient, division for you as per your genetics. What kind of a diet will help you in maintaining your weight, not only just losing weight? Because in some cases, what happens, there are n number of diets online. ठीक है, अभी अगर आप टाइप करोगे weight loss diet, you will find another 200 diets of weight loss right there in front of you, sample diets. But what happens is, you follow that diet, you will see some changes definitely, but there is a chance of a yo-yo effect, right? You will put on that weight again, because to some extent it's just like, wearing someone's clothes. Now, if I wear clothes of someone who is, let's say, 2 sizes up than me, now will it fit me? Of course it will, because I'm leaner, right? But is it exactly fitting my size? It isn't. So that same principle applies to diets. For some time it will work for you, maybe for a week or 2 weeks, but then later, can you sustain it? No, because it is not made as per your requirements. Okay, so this follows by the fact that, every individual DNA is varying by 0.1 percentage. So the kind of diet that will suit a person for weight loss, weight gain, weight management, whatever, is very, very different. Okay. Then we have diabetes, and we all know that India, amongst a lot of other countries, is now at the helm of, developing diabetes as a major issue apart from heart disease, right? It's worldwide, okay, accepted that diabetes is the next, cardiac disorder. So diabetes is not only related to your genetics. Now, if I ask you, family mein kisi ko diabetes tha, and you will, if in case you already are aware, you will tell me, yes, my parents had or my grandparents did. But now, if you are aware that nobody has been diagnosed with diabetes, so you'll be quick to say, no, I don't know of anyone, my parents or my grandparents, nobody had diabetes. But then your report shows a moderate or a mild risk. So you would get confused. You'd be like, why is this so? I don't know of anyone with diabetes. My uncles have diabetes. So now, do you see the link? If your uncle has diabetes, which could mean that the gene has come from your grandparents, okay, which is the reason why you have it in a mild risk, because it's from your grandparents' ancestry. Now, your grandparents may not have been diagnosed because their lifestyle was good, but they still passed on the gene. So if your uncle has it, which means your father may or may not have a copy of it, but it is being passed down to you, right? So now the issue here is that we always think that just because we know our family history means we know what issues we have. There could be certain genes that are silently passed down, which you are not aware of. So this you would only know if you get the genetic test done. And when it comes to the category of diabetes, it not only talks about the predisposition to diabetes, but also a solution to that. Now, you might be quick to say, diabetes does not have a solution. It can be managed. But type 2 diabetes, I will tell you, there have been a lot of reversals. Okay. And it's not like type 1 diabetes. Understand the main difference between the two. Type 1 diabetes is insulin dependent. Your body will need insulin. because your body can't produce it. When it comes to type 2, it is dependent on a lot of factors. Your body is showing insulin resistance, which is one of the genes that we are testing here. So whether you have a risk of insulin resistance, how does fiber and whole grain interact with your genetics? Because if we understand the basic principle of nutrigenomics, it is how food affect your genes, right? So here, fiber and whole grain being the main components of your diet, every diabetologist will tell you, take fiber, it's good for you. Of course it is. But in certain cases, that very fiber, especially in the insoluble form, can affect the your TCF7L2 gene. And it can actually put that person risk of more elevated blood sugars. So here, diabetes category talks about risk of diabetes, the foods that help you in reversing or managing diabetes. Also, the complications that's associated with diabetes. Now, since you know, diabetes does not just happen, if it is prolonged, it will not just stay as diabetes. It will start affecting other parts of your body, other organs, whether it's your eyes causing cataract or retinopathy. It could affect your nerves causing neuropathy, kidneys causing nephropathy, right? So it could also cause something like the foot ulcers, right? Or diabetic foot, as we call it. So these all also are a part of diabetic complications, which we check at a risk of. Okay, also there is an important part about tobacco smoking and alcoholism. Now, these factors also affect the onset of diabetes. Now, if you don't have a risk of diabetes in your genetics, does that mean you are exempt from it if you ignore your lifestyle or diet? No, right? So because diabetes is not only genetic, but also a very, very much a lifestyle related disorder as well. Okay. So thyroid related health again focuses on not just hypothyroidism, but it also talks about how your sleep and exercise interacts with your gland. How does it work? And also it talks about a very important factor here is your risk of autoimmune disorders linked to your thyroid gland. Everyone talks about hypo and hyperthyroidism, but there is another factor. TPO antibodies usually is not checked when T3, TSH, and T4 is done. But TPO antibodies also helps you in understanding your risk of, or if you've already developed autoimmune disorder of thyroid gland. अब अगर hypothyroid आया है, okay, but the thing is, it is causing a lot of other changes in the body, unlike what it does in normal hypothyroidism, then TPO antibodies has to be checked because there are two very important autoimmune disorders linked to the thyroid gland. It's called Graves and Hashimoto's disease. So Hashimoto's causes hypo, Graves causes hyper. In both the cases, your body's cells are attacking the thyroid gland, but in case of Hashimoto's, it ends up causing hypothyroidism. And in case of Graves, it causes hyperthyroidism. Okay, so this thyroid health category talks about them. I will show you the report. You will see all of the phenotypes that I'm talking about. Okay, then you have cardiac health. Cardiac health, very important because right now we are in a time where we are seeing a lot of these issues cropping up, and it is not age dependent. By now we know that if a person suddenly is having a pain in the chest or is having breathing difficulties, and if this person is just, let's say, 30, it doesn't mean that this person ignores these signs and saying, you know what, I'm young, I can't have a heart issue, right? We can no longer say that, because now, considering what we are seeing in the news, in the newspapers and everywhere, it is very, very important for you to get it checked early on, better, right? So cardiac health includes everything, not just your lipid profile, because we are always quick to say that, my cholesterol is normal, so I don't think I would have any issues related to heart, because that's what we link it to. Usually that's what has been told to us, and that is what we know. But now there are other factors as well. Hypertension, if it is not controlled, because hypertension is usually ignored, saying that हाँ ठीक है मेरा BP थोड़ा ऊपर नीचे होते जाता है, right? But वो ऊपर नीचे में क्या होता है, when your hypertension is prolonged, it starts affecting your heart indirectly. There is something called left ventricular hypertrophy, where your left ventricle is enlarged. That happens with prolonged hypertension, which could indirectly cause sudden cardiac death. So that is also one of the genes that is checked in cardiac health, other than homocysteine, which is, we've already spoken of it. It is a simple amino acid, but if it is elevated, it is one of the reasons for sudden cardiac death, which cannot be revived. Okay, it is myocardial infarction or heart attack, in other words. Okay, so cardiac health is again a long category. We will look into it. Then you have organ health. When we talk about organ health, we are covering everything else that we did not cover in other categories. For example, your risk of normal cataract, not diabetes related. When we talk about your years, when we talk about your uric acid elevation, we could talk about your liver related disorders. Okay, so liver related disorders, whether it is alcoholic or non-alcoholic, dono pata lagta hai. Then your risk of liver cirrhosis, right? So all of this is covered under organ health. Even your gallstone predispositions or something like your IBS or inflammatory bowel syndrome. So all of this is covered in your other organ health, where your gallbladder, liver, eyes, ears, etc. The genetic predispositions associated to that is understood. Then you have kidney disease. Now, kidney disease, as we know, can get fatal if not corrected or taken care of earlier. Now, which part of your bodies do you think is associated with detoxification? Right? It is your kidneys, your liver, and your skin. Okay, they help in detoxifying your system of toxins that are built up in your body. When we talk about your kidney health, we're talking about the nitrogen buildup in your body. अगर आपने कभी भी एक kidney function test कराया होगा, you must have seen there is something called BUN, creatinine, right? So what exactly are these parameters? Now your kidneys ka main function is to filter out the toxins in order to increase reabsorption of electrolytes, okay, and to eliminate excess nitrogen from your body, because we consume protein as a part of macronutrients, right? So कभी कभार अब क्या होता है, why do we say protein? अगर आपको खाना भी चाहिए तो एक लिमिट के अंदर खाना चाहिए. A lot of people who work out and all, they keep packing proteins on in their body, and you must have already heard that some people, when they take a lot of protein, they end up with nitrogen toxicity that could actually be fatal, right? If in case their diet does not have enough of water, okay, in order to eliminate that nitrogen, or if they are taking too much protein than what their body requires at that point of time. So when it comes to kidney health, what you need to ask yourself is, how much water are you drinking? If you're getting your kidney function tests done every year or no? If you have a family history, how frequently are you getting your kidney function test done? So this is very important. And if you know, if you are at a risk, let's say, you can still prevent it, right? So this talks about your kidney health. Then you have inflammatory diseases. When we talk about inflammation, iska matlab kya hota hai? Simple language mein सूजन, right? Ab this inflammation agar bahar hota hai on your hand or on your face, you can see it, right? Now when you can see it, you correct it. But what about the inflammation that happens inside of your body? Can you see it? You can't. The only way you can rely is the signs that your body gives, which sometimes we ignore, right? If you have knee pain, joint pain that has been lasting for a longer period of time, for some time you'll keep ignoring it until it actually gets so bad that you'll have to go to the doctor, to get it tested. That is one kind of inflammation, whether it's rheumatoid arthritis, osteoarthritis. Other kinds of inflammation could come in the form of skin allergies, right? So we have certain set of inflammatory diseases that we talk about, wherein you get to know the predisposition. It could be that you already are aware that how many family may, rheumatoid arthritis reh chuka hai, so maybe that's why I have a risk. In some cases, it could be a mild risk because it was not detected in your family, and maybe they weren't, diagnosed with it because wo gene express hi nahi hua, but it has passed out through the generations, right? So that talks about inflammatory diseases, where we have a broad spectrum here, like rheumatoid arthritis, rhinitis, asthma, pancreatitis, COPD. Some people utte se hi, they keep sneezing a lot. They have issues, and this is not seasonal. Na? वो होते जाता है, मतलब रोज उठते से ही, right from children to adults, there are some cases always where they keep having watery eyes, they keep having a blocked nose all the time. Okay, so these are signs where a person could have allergic rhinitis. Okay, so this is a genetic issue. Now, when we talk about neurological health, It is one of the very important categories, because I keep saying this and I've said it before. When it comes to your brain, the cells do not regenerate like the other cells in your body, right? Why do we ask everyone to keep their mind active? At the same time, not just that way, not just activity wise, but also take care of your brain in terms of the food that you give your body. So when whatever you give yourself, you know, the main way by, or the pathway by which your brain gets the energy is glucose. Glucose is the major source of energy for your brain, right? But now in certain conditions where people, they want to try different kinds of diets, let's just say keto diet. No judgment on people who follow keto diet, but keto diet is specifically followed for people with certain health conditions. Okay. In certain cases like epilepsy or seizures, usually glucose is the main issue. So here it is cut off, and that's why we give keto diet. But people tend to find it as a fad and they follow it. But what happens here is your brain shuttles the utilization of glucose to fat. But such people, when they don't check their blood ketone levels, it could lead to acidic coma. Because what is essentially happening is fatty acids or ketones are acidic in nature. And when there is excess, that excess gets accumulated in your brain, right? So there have been a lot of cases where people, it has been fatal for some people following a keto diet for a very longer period of time. Even doctors for children with seizures, they do support the keto diet, but here they ask you to stop following it after a certain months, because you cannot sustain on that diet, right? So when it comes to neurological health, we are checking a lot of cases here or parameters here. Alzheimer's, and not just the usual Alzheimer's, but early onset of Alzheimer's by 8 years, if you have the risk of that, then you have Alzheimer's risk, ADHD, dementia, vascular dementia. Okay. Also, how certain foods like, pesticide laden foods, to what extent could it cause toxicity, autism, schizophrenia. So all of these are checked under neurological health. But how do you take care of your neurological health is most important, because your food contains nerve support nutrients, and you know about that. Vitamins like B6, B9, B12, vitamin D, and omega 3s are the best foods you can provide to your brain, so that it protects the nerve cell and the connections that happen. Apart from your own, of course, mind body interventions, physical activity, meditation, etc., etc. Okay. So, how do you take care of your neurological health? And if you have these risks, how can you prevent them? Is an important part that we discuss in this particular category. Then you have eating disorders and addiction risks. When we talk about eating disorders, you may not be that aware of it. You must have heard of it. Things like anorexia and bulimia, right? Now, these things happen. You already correlate it to, young girls nowadays who have this particular notion of a perfect body, and they stop eating if they are gaining weight in order to match up to the skinny version that is in their head, the most desirable version in their head. Now, in this case, parents need to be very, very aware of, their kids' tendencies. I'll give you an example. In this case, the parents were unaware when I was counseling, and there was this 15-year-old girl in front of me with her parents. Now, understand, the child is not going to be very vocal about the fact that, yes, you know what, I've stopped eating, or, I eat and I tend to throw up because I feel, that I'm gaining weight. So she didn't say anything at that point of time. And the parents were like, no, I don't think she has any of these tendencies. Now the parents get up and go, and she comes inside and she tells me, you know what, I have been experiencing what you said about bulimia, but I've not been able to tell this to my parents. So it is so important for parents to have a one-on-one dialogue with children when it comes to eating disorders, and their expectations from themselves when it comes to their body, the way to they perceive themselves. Okay. Addictions, very important, is linked to a particular, you've seen in the addictions chapter, it's linked to your neurotransmitter called dopamine, right? Now, this dopamine creates a reinforcement of an activity. It could be alcohol, drugs, smoking, etc. Because once you start it, your brain gets a high of that dopamine, but that is not at the level which your body regularly produces, right? It is much higher than that. So now, the moment you take it and then you stop it, your brain again wants that. So that becomes a toxic cycle. So from the addiction risks, what can you know is what are the chances of you developing it even if you take it occasionally? Because now you can tell me that, you know what, no, I'm an occasional drinker or something of that sort. But if you have a high risk of developing addictions or dependencies, the chances that you won't be able to leave it are higher. Okay, in some cases people may not actually even drink or smoke, but then they have the risks. That means the person has never tried it in their life, so that doesn't mean that they will get up one day and someday become addicted. It only means that the chances of them passing on to their children, and if you're getting it done for your children in order to pay attention to their peers and their surroundings so that they don't end up becoming addicted, becomes an important category. Because addictions can actually maim a person's life. You know, it can halt a lot of aspects of a person's life, whether it's personal life, career. It can actually cause a lot of issues. Okay, mental is just one of them. Then you have gender specific risks. When we talk about this, for a male, there are 4 phenotypes. For a female, it's 4 phenotypes. So based on what gender you are, the report will have only those phenotypes pertaining to your gender category. Okay, so when it comes to male, we do check for male pattern baldness, we check for infertility, testosterone related issues, and LDL cholesterol based on your, you know, testosterone levels, as well as the fat consumption. So when it comes to women, on the other hand, we talk about PCOS, which is very, very common nowadays in girls that are even 15 and 16. They have PCOS, that is polycystic ovarian syndrome, that can cause issues in pregnancy in the future. We also talk about neural tube defect, adverse pregnancy outcomes. So this is very, very important for not only women who are going to plan a pregnancy, but also earlier on in age, wherein girls can understand how they can take care of their hormonal health as well. Okay, so hormonal health gets affected by a lot of things nowadays, right? It is not just food, but also it is lifestyle choices, habits. So whether it is male or female, whether it's testosterone or estrogen, it is very important for you to take care of these hormones by assessing your diet and your lifestyle in order to prevent these issues. Then you have DNA damage and biological aging. When we talk about DNA damage, we're talking about tandoori food here. Now, all of you here who are fans of tandoori chicken and all of that, there is nothing for you to worry about. Even if you carry this gene, you're supposed to limit the consumption of tandoori meat. It does not apply to vegetarian. So even if you're a vegetarian and if you see this gene that you have a high risk, it doesn't have to mean that you are going to take it or your ancestors have taken it. It only means that your gene is susceptible to amines. Amines are released only when meat is charred at a high temperature. Okay, so if you see that you carry this particular risk, you are supposed to limit your tandoor consumption to twice or twice a week or two, servings per week, not more than that. Okay, so this is very interesting for people. Nowadays they think tandoori, matlab kam tel hota hai, so it is, for people who go to gym. I have seen, where a lot of people, they have grilled chicken like at least 4 days a week or 5 days a week for that matter. They'll have salads, but uske sath grilled chicken. Okay, so here they need to, they wouldn't know how it is affecting their DNA. In this case, it can change your sequence, in the sense it can damage your DNA on a sequential level. We talk about the fact that genes do not change in sequence, right? But here the DNA damage can happen on a molecular level that can actually cause mutations or certain issues like cancer. Okay, so here you get to know. And apart from that, biological aging, which is your longevity. Okay, when we talk about longevity, there are 2 types. Either you have a typical longevity, which is an average of 70 years, or you have a higher longevity that is 90 years up. Okay, so this is what you get to know from this particular category. Drug response is based on pharmacogenomics or pharmacogenetics, which you've seen earlier on, how medicines affect a person's genetics, or on the basis of a person's genetic, which medication works better, right? Now, in this case, we are checking for at least, I think there are about 8 of them, where the first three talk about diabetes-based medications. Then we have atorvastatin, we have methotrexate, which is given in rheumatoid arthritis, and we also have blood thinners like warfarin that we are checking for, which is very, very important. Imagine if a person isn't able to metabolize warfarin, which is a blood thinner, which is usually given in certain heart conditions. Imagine the havoc that is going to wreak on the person's body, right? So why this particular category is important, or why this category is one of the popular ones here, is because a lot of people are on certain medications for years and years, and it's actually not helping them, right? So this helps in shortening the treatment time. Okay, so this category helps in understanding that aspect. Then you have fitness. What kind of activity will work for you? What kind of a diet you need to take before and after your workout? If in case certain activity like HIIT, which is very common nowadays for people to do for weight loss, or for that matter, even functional training, does it even work for you? Are you prone to injuries because of that? What are the injuries you're prone to? As you age, do you have a risk of your muscle mass going down to a point where you have a risk of sarcopenia? How is your motivation to exercise? Fitness is a very long category, and you will see it. I think it has about 23 phenotypes in it. Then you have circadian rhythm. Circadian rhythm is your human biological clock. The last class, I think it was taken by, yes, it was taken by Riddhi, and she spoke about epigenetics and your biological clock, right? Now, your biological clock is all controlled by one, which is in your suprachiasmatic nucleus, which is in your brain, right? When we talk about circadian rhythm, your body's clock, there are various clocks in your body. Now, one clock will decide your sleeping pattern. The other will decide your metabolism. So here in your circadian rhythm, you get to know which is the better time for you to work out, whether it's in the morning or evening. How is your metabolism? Can you limit your carbohydrate intake towards the first half of the day, or you can easily take it leisurely even in the second half? So you get to know, as per your genetics, what exactly is your circadian rhythm like? What does it follow? Okay, and the last category is immunology genomics. When we talk about immunology, or the immunity aspect of your body, there is a very important parameter called oxidative stress. Oxidative stress kya hota hai? As a part of our usual metabolism also, we produce something called free radicals, right? Are you aware of that? Now, free radicals are not something that is uncommon in your body. As a result of our metabolism, digestion, respiration, etc., there is an influx of oxidative stress that is happening. Other reasons why oxidative stress could build up is because of external factors like radiation, pollution, smoking, drinking, right? It could also happen because of certain underlying issues that you already have, like heart disease or your diabetes. So oxidative stress, when it builds up, it can induce inflammation if it is not controlled, and then it can cause diseases. Okay, so this oxidative stress, in order to nullify or neutralize, we need antioxidants. So you need to detoxify your system as well. So here in immunology genomics, you get to know about your susceptibility to the increase in oxidative stress and how your body handles toxins, if it's able to detoxify it well, or you need to help it help you. Okay, so this are the categories that we are going to see in the genetic report. And now I'll just show you the report. Okay, any doubts, any questions? It can be very interactive for that matter, because I'm sure it's just last two chapters and you all have finished it. And we have enough time now to discuss if you all have any doubts. Okay, Abhijit sir, yes, you can ask me. Before we go into the report, we can take questions, sure. One second, let me just mute you.
Yeah, hi Reena.
Hi, sir. Good
Yeah,
morning.
I have a few questions regarding the last class which Riddhi took. I'm not sure I understood the DNA methylation which she talked about. Can you just help me understand it?
Yeah. So DNA methylation is what I'll tell you. When your DNA, okay, you remember when I told you now, if I'm carrying a chit in my hand, okay, and I ask you to read, okay, you won't be able to read because my fist is closed, right? Now, but when I open it, you would be able to read it. Now, what methylation as a process is, there are certain tags or chemicals. Okay, now these chemical tags could occur because of some other, chemicals, environmental influences, lifestyle changes, diet, etc. Now, these chemical tags can attach either to the DNA itself or to the histone tail. Okay, now just imagine these tags coming and attaching to certain part. Now, if they attach to a particular part where they activate that particular area, so it will be open to reception so that your mRNA can read it. So in some cases, what happens is, if certain areas of your DNA which should be suppressed are activated, let's just say tumor suppressor genes. What do tumor suppressor genes do? They suppress the tumor formation. But now imagine, because of methylation, there are these tags that are coming and attaching to a promoter region where, where it is supposed to be suppressed, it gets expressed. As in, your tumor gets, the one that starts cancer, it gets expressed. So that case, methylation, if I explain to you in simple words, is chemical tags that attach either to your DNA or your histone tail that actually express certain genes that should be suppressed. And in some cases, the things that should be suppressed, they get expressed. Okay, so methylation is an important part of your body. It happens on a daily basis. It is a reason for cell division for a lot of processes in your body. But in some cases, these methyl groups or these methyl tags, they attach to, unnecessary places where it is not required. Okay, so that is, you must have seen that there are various ways by which, there is histone modification, then there is acetylation, there is methylation, there is demethylation and deacetylation as well. Okay, so one of the videos in that chapter, it will help you understand it better. The very first video of, I think it's the amoeba sisters. Okay, so in that you will see that if the methyl groups, they come and attach to a certain place, if it is the part which is, rolled around the particular histone, it becomes looser. So it is easier for the mRNA transcription to happen. So like I said, if it is loose, transcription can happen faster. If it is tied, how will the transcription happen? So methylation and acetylation are two processes by which either, depending on where it is attaching, genes can either be expressed or they will be suppressed. Okay, and these are the main reasons for epigenetics to happen. That is the reason by which, you know, we can actually rely on the fact that we still have certain control over our genes, because when we change our lifestyle and our diet, we can actually downregulate or upregulate certain genes and the gene expression. Okay, so the chapter of methylation, that chapter is, I think it's in epigenetics, it's the very first chapter in epigenetics, right? So that chapter will help you in understanding how these, apart from, of course, your internal cue and your internal atmosphere that's influencing gene expression, because gene expression is regulated by your genetics itself. जैसे regulatory bodies नहीं होते हैं companies के लिए, वैसे your body has its own regulatory mechanism and it will regulate it. But this methylation and acetylation process is also dependent on your external environment. And this is one of the reasons by which your genes, they get regulated on their own. Okay, so this is usually how the methylation. If you have any other doubts, you can ask.
Okay, one more thing is there are a lot of people who advocate drinking alkaline water nowadays. So is it advisable, and what benefits does it carry?
Okay, so by research, what has been proved is, now I'll give you a very simple example. Kahan se aaya that the whole alkaline water thing? You know, there were these freshwater springs. You will see it even in India in certain places like Manikaran, right? Now over there, these freshwater springs have known to actually benefit a person in a sense. It helps in, you know, reversing hypertension and taking care of their health issues in a way, and also, you know, give a better skin, etc. So what was found is that this alkaline water, it contains a lot of minerals. Okay, and when it comes to alkalinity, it itself means there is more minerals and that it's less acidic. When we talk in terms of the water that you consume, now if you see the tap water, or for that matter, you know, your the water that you get, the bottled water and all, they do have a pH. They have a neutral pH, say between 7 or 7.2. Now your body's pH itself is 7.2. And as far as disease, and you know, if you see particular line of disease and good health, the more you turn towards acidic, your body turns acidic, you're more prone to diseases. If you can maintain that alkalinity, that alkaline nature of your body, then it is towards good health. You also need to understand that your body has different pH throughout your body. It is not consistent. Your body has one pH, and you know, your other areas like your intestines has an alkaline pH. So these are different. You know, the nature of your body is such that it maintains the pH on its own. But when it comes to the water that you consume, if in case you have any health issues like, you know, a urinary tract infection or, you know, hypertension, etc., a pH of 8 to 8.2 has known to have very good benefits in terms of health. It helps in preventing any issues related to diseases. Now, to what extent you need to take alkaline water, you don't have to go beyond 8 to 8.2. Okay, because when you do that, you're essentially taking salts, because that something like sodium bicarbonate would be like, you know, 10 pH and 11. There are a lot of people who end up taking water with 9.5 pH, 9.8 pH, because they think alkaline water is very good. But what you're essentially doing is you're drinking water with a stomach acid pH, wherein whatever you eat will not digest and you will actually essentially throw up. Okay, so even if you're taking alkaline water, which is good for your health, you need to make sure you understand to what alkalinity you need to take so that you have good benefits of it. Okay, so whether you have an alkaline water machine, which is very easy for you to, you know, then procure the alkaline water, or you make alkaline water at home using, you know, lemon or cut cucumbers and put it in a water. A lot of people do that. That's detox water and that's alkaline water free. Okay, so whether you do this or you directly take alkaline water, it is good for you. as long as you know to what level of alkalinity you're taking, because the first thing that becomes alkaline is your urine. The other parts of your body, research wise, do not turn alkaline or acidic on the basis of that. It's your urine that changes the pH, because of which your body actually benefits. Okay. And yeah, so alkaline water is healthy, it is good for your health, but the range of alkalinity is very, very important. Otherwise your stomach is going to have issues, because your stomach is an acidic pH.
Okay.
Okay.
Yeah.
Any other doubts?
Dina, one more thing, Rina,
Yeah.
is some ladies experience during the pregnancy that the pregnancy doesn't complete for the entire 9 months. 2 or 3 months down the line, the body rejects the pregnancy and it keeps on happening. So does the genetic test reveal any kind of thing